Well, a knee replacement should be considered for any patients who have significant pain or loss of function because of knee osteoarthritis over a period of time of several weeks or a few months. Well, for the majority of patients, if they do need a knee replacement, they'll only need one in their lifetime. The length of survivorship of a knee replacement is on average 25 years. And for most patients, that would comfortably see them through a lifetime of use. For occasional patients, there is a reason to re-revise or re-replace the knee replacement. The commoner reasons for that is if the knee should fail because of wear, causing loosening and pain of their knee. And as for a small number of patients, because of an infection or because the knees become unstable, or they have had a fall and the fracture should cause some loosening of the knee replacement, or for patients who have a lot of pain or stiffness associated with their knee replacement. Surgery for the knee replacement is performed under an anaesthetic, usually a spinal anaesthetic, sometimes with a light general anaesthetic. The surgery itself involves preparing the leg with antiseptic, a skin incision over the front of the knee. The kneecap is turned to one side, and then we use alignment jigs to align and size the knee. We use specialist cutting jigs so the cuts are performed accurately for the size of the knee, and the bone and cartilage is removed to allow the implants to be positioned accurately in a good alignment, good position. And we then use trial implants to make sure the length is correct, to make sure the knee feels stable, to make sure the kneecap tracks well with knee flexion. And then the implants are used, cemented implants are used and inserted. And again, we check the tracking, we change the liner from a trial liner to a polyethylene liner. And then the knee is washed out and is closed up in layers. And I put lots of local anesthetic into the knee to help with comfort. And so that's how the knee replacement is performed. But essentially, after that surgery, the knee is, the implants are well fixed and are able for the patients to put all their weight through confidently, knowing that the knee will withstand the pressure of weight bearing and will be stable for the patient and will allow a good range of bend with physiotherapy afterwards. They're very successful knee replacements at removing pain and giving a quality of function, a quality of life back to the patient. They are being used for many years in high numbers. The later implants have a better success rate than the early types of the knee replacements. The knee replacements always feel slightly mechanical. Patients do notice a difference to the original knee. They do click occasionally, but for the vast majority of patients, they are very pleased with the results that they've had, with the function they've had returned to them, and the pain relief they've had. For a very small number of patients, they do struggle with things like stiffness, swelling, and for a small number of patients, discomfort with the knee replacements. And that is really down to making sure that patients who would benefit from the knee replacement make sure that they have the surgery at the right time. It's not when the arthritis is too early, to make sure they get a really good recovery and good functional outcome following their surgery. The common reported side effects is initially with swelling and stiffness, and so it's very important that patients really buy into the physiotherapy rehab program following surgery to get the knee moving as much as possible. Less common side effects can be associated with pain, with some numbness at the side of the knee. The other side effects, very, very uncommon, things like wound problems, infection, long-term pain, or instability of the knee, much less common following surgery.